Chinese regulators had been ramping up pressure on the tech firm to break away from U.S. capital markets, citing data security concerns.
And now, the East African anthem by the Status Choir.
Mungu twaomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu, Jumuiya yetu sote tuilinde. Tuimarike, umoja wetu ni nguzo yetu, idumu jumuiya yetu.
And now, as we remain standing, allow me to invite the opening prayers from Alice Machanga, who is from Ministry of Health, Nursing Department.
God our Father, we come before you this morning to thank you for the gift of life, for the gift of this nation of Kenya. We repent our sins that we may have committed, dear God. We are coming before you this day as we celebrate the nurses of this country, as we celebrate the leadership of this nation. We ask you, Lord, that you may guide us, begin with us, be with us throughout the day, and may you continue to bless each one of us in all the things that we do. We thank you for the people who are planned for the event, that you may continue to give them more knowledge and wisdom to reconsider other people in their society and to embrace the gift of life and enhancing humanity in all of them. We trust this, we pray, in Jesus' name we pray and believe.
Thank you, Your Excellency. Ladies and gentlemen, kindly be seated. Your Excellency, the First Lady of the Republic of Kenya, Margaret Kenyatta, our representative from the Ministry of Health, our partners alike, when that time comes, we shall introduce you, and all the winners from the 37 counties, and all the participants of this wonderful program, whereby today, as we celebrate the Beyond Zero Summit here in State House, distinguished guests, ladies and gentlemen. On standby beside me is our Chief of Staff in the Office of the First Lady, Madam Constance Gakonyo, to come and make the welcoming remarks. Welcome, Madam Connie. Makofi kwake anapokuja.
Good morning, everybody. Your Excellency, Margaret Kenyatta, Excellencies, distinguished guests, ladies and gentlemen, welcome to this function. On behalf of Her Excellency Margaret Kenyatta and Beyond Zero, it's a great pleasure to welcome you to the Beyond Zero Summit 2021. We have representation from national government through the Ministry of Health and other sectors without whose support we would not be here. We also have embassies and high commissions representing the international community who have supported Her Excellency's work over the past 9 years. together with private sector, NGOs, the UN family, civil society, media, and others. I warmly welcome our special partners from across the counties who have been the key drivers of our work. We have a very special group of people here, our health workers, the nurses and midwives who are very dear to us all. You are but a small representation of the many watching us from across the country. A warm welcome to all of you who are attending this event virtually. We welcome our esteemed panel speakers, comprising of representatives from the National Council, the Nursing Council of Kenya, the Kenya Medical Training College, the National AIDS Control Council, Roche, and the UN. We also acknowledge the presence virtually of Professor Margaret Crook from Harvard University. Your presence here today speaks volumes, as it greatly demonstrates the value which you attach to the Beyond Zero initiative. Earlier, I hope you were all able to see and appreciate images of some of the nurses working in primary health care facilities across the country, and really just admire the work that they do. During this event, the Mashujaa Africa Band and our very own State House Choir will provide entertainment. And most of all, we will be celebrating the recipients of the Beyond Zero Health Awards. Asanteni sana, and enjoy your morning. Thank you.
Thank you, our Chief of Staff. Thank you for that wonderful opening remarks. Your Excellency, the First Lady. Before we continue to another level of the program, you have just arrived and sat down with us. We'd like to give a bridge. I want to welcome you on the other side of the stage and also on the screen, as the State House Choir brings us a song, tunashangilia na tunashukuru Maulana kwa sababu yako Mheshimiwa Mama wa Taifa.
Hekima pakutupa kiongozi mchapa kazi, pakutupa kiongozi
Tupige makofi shujaa wa Kenya. Your Excellency, you are heroes. We celebrate you today as we celebrate the nurses. You are a shujaa wa Kenya. Thank you. Thank you very much, and we are humbled. Your Excellency, distinguished guests, ladies and gentlemen, it is now my great honor and privilege to welcome my co-MC, who is taking us a notch higher. This is none rather than Janet Mbugua, the renowned journalist here in our country. Let us put our hands together for Janet Mbugua.
Wow. Thank you. Thank you so much for that, June, for that honor. Your Excellency, what a privilege and honor to see you, distinguished guests, ladies and gentlemen. It's an absolute honor to be here. It's a cold morning, but the spirit of today is warm. So let's keep that with us in our hearts. I'm your moderator today. I'd like to take a few minutes to just invite our panelists. Settle down. I'll give a little bit of context as to why we're having this critical conversation, and then we will have a few questions for them. We've been working with Beyond Zero for many years, and so it's pertinent that we are able to hear their perspective. This person that I would like to invite to join me here on stage is Dr. Stephen Jackson, Resident Coordinator, UN, and we can give them a round of applause as they make their way. That's allyship. Thank you. We also have Dr. Ruth Marsha, Chief Executive Officer, National AIDS Control Council. Karibu sana. Thank you for that warm applause. As Dr. Ruth Marsha makes her way to the stage, I'd like to invite Dr. Jack Olwoch Kelly, Acting CEO, Kenya Medical Training College. And then we also have Edna Talam Kimayo, CEO, Nursing Council of Kenya. Karibu sana. And finally, Peggy Gruninger, Head of Roche Corporate Donations and Philanthropy. Thank you so much. Let's give her a round of applause as she makes her way to the stage. Thank you once again to our panelists. And this is really to hear different perspectives of delivery universal health coverage through primary healthcare. Primary healthcare is often the first point of contact, and these nurses are incredible nurses today. We really celebrate and honor you. Our first point of contact at whether it's dispensaries or whether it's health centers. And so speaking to these incredible partners today to get a sense of why this day is so critical and really the journey that's brought us here today. So I'd like to turn my attention to Stephen. And you know, I know there was many years ago that the UN called Beyond Zero a game changer. How would you encourage private sector towards better investments for critical elements of primary health access, specifically on supply chain, health information system, and commodities?
Well, Janet, thank you so much, and good morning, everybody, and Your Excellency, the First Lady, thank you so much for the invitation and for the partnership. We're oranging the world. We're halfway through the 16 days of activism, and that seems to me to be a very appropriate moment to be coming together today around Beyond Zero, and thank you for your leadership on that. I suppose it's a bit strange, Janet, or it might seem a bit strange to be asking the United Nations, which after all is one of the biggest public sector actors in the world, to be talking about the private sector. But actually, here in Kenya, we're very, very proud of the partnership that we have between the public and private sectors for the delivery of the Sustainable Development Goals overall, but particularly, I think, leading on primary health care. Working with Beyond Zero, working with many of the partners in the room, working with the Chinese government, with the Dutch government, working, of course, with the national government at national level and at the county level. And I wanted to salute also Prof. From Kisumu, who co-chairs with us our primary healthcare window within what we call the SDG Partnership Platform. And what does it do? It brings together government and private sector to deliver primary healthcare outcomes for profit. Because guess what? It turns out that there's a $6 billion market, profit-making market, for the delivery of basic, life-saving primary healthcare in Kenya. And we calculated that number, Janet, a few years ago through a feasibility study. And as a result of that, working with organizations like Roche, with Royal Dutch Philips, many others, we're starting to crowd in private sector investment into the delivery of PHC, primary health care. Just a few words, a few examples on how we do that, and I promise not to be very long. First of all, in the delivery of PHC clinics, so actually staffing them, training them, operating them, setting them up. And various counties represented in this hall are leading on that charge. You also asked about manufacturing and commodities, and I think that's a really key area for us. Let's be honest, the world hasn't done very well at contending with COVID, has it? And for Kenya's health security going forward, for the continent's health security going forward, we're going to need a stable manufacturing base of the medicines and the commodities that we need, be those antiretrovirals. And Your Excellency, I had the honor to be together with your husband 2 days ago in Nakuru for World AIDS Day when we were talking about exactly this. We also need manufacturing capability for the COVID vaccines. Last thing I'll say, financing for the public health sector. So we're going to be launching early next year the world's first development impact bond for adolescent reproductive and sexual health services. And that's working with many of you in this hall. So that's what we call a blended financing instrument, where you bring together public and private capital to deliver a really key health outcome for adolescent girls. And that, of course, is very much around prevention of teenage pregnancy, which is a major priority for Beyond Zero, and breaking the link between teenage pregnancy and the transmission of HIV, which was one of the major focuses this year for World AIDS Day. So I hope that gives you a flavor of why it is that we're working so closely with the private sector in this, Janet. And thank you.
Thank you so much for that, and thank you for speaking to that critical element of the multi-stakeholder approach. And we'll come back soon to get some of those, the call to action and recommendations, if you will. Dr. Ruth Marsha is next, CEO of the National AIDS Control Council. I know Dr. Stephen Jackson has just spoken and intimated details about HIV/AIDS. But what is the NACC doing towards especially adolescents and young people in reducing new HIV infections? I know we had some breakthrough information on World AIDS Day not too long ago. But talk to us about what's working and what's not, and what you would like to scale up, if you're able to just capture all that for us in an answer. Thank you.
Thank you very much, Janet. And Your Excellency, thank you very much for inviting us. And indeed, this day just reminds us that when we speak about adolescent girls and young women, when Her Excellency started this journey, we presented to you some statistics. And those statistics then were very worrying. And we had this clarion call saying, we want zero new infections, zero deaths related to AIDS, and we also wanted zero stigma. And Her Excellency asked, whose child is going to be infected? And that's why she said, let's go beyond zero. So the conversation about adolescent girls and also boys, it's about going beyond zero. Because our zero then, our targets were saying less than a certain level. But she said, let's go beyond, because there must be something we can do for every girl and every boy in this country. Now, what is the challenge? We've done well. We have been able to reduce new HIV infections by around 68% in this country. But then the challenge is that we are also growing an epidemic. Because when you look at the 15-year-old, what are we doing? We have seen progress, but the progress is not enough. Her Excellency says run, but we are walking. So we need to walk, but you need to run. So it is the pace that we are complaining about. Then we start looking at other challenges that are coming up. As we are sitting here today, just before the month of October, you can see the numbers of teenage pregnancies. And so what is the National AIDS Control Council doing? What we are saying is that we probably don't have to use the old solutions that we had. We need to bring the girl at the center. And when you look at this girl, there are quite a number of threats. By the time she's turning the age of 10, there's gender-based violence. We start beginning to see sexual violence cases. We start to see her having early marriages. We start to see mistimed pregnancies. And so the conversation you're going to have, how do we place this girl at the center of our conversation? Rather than us trying to say we have an intervention for teenage pregnancy, we have another intervention for early marriage, we have another one for HIV. It is the same girl we are talking about. And this is the lesson we are learning from Beyond Zero. We can all come together and look at this girl and say, what does she need from us? Is it the adult conversation of 80s? Is it the adult conversation of 90s where sex was never discussed? This girl who starts MENAC does not even know who to talk to because their household, even in the best homes, no one speaks about sex. How do you change the conversation between parents and children, teachers and children? And that's what you're saying, that we must have a disruption conversation that stops us from doing the same thing we were doing before to save our girl. Thank you very much.
Thank you. Thank you for that. Thank you for speaking to bold conversations. You speak about the challenges and gaps for the adolescent girl. You've talked about issues like gender-based violence. There's period poverty, which is something I've discussed a lot, and it's true. I think there's a sense that these conversations are not being had when we look at how the teenage pregnancy crisis kind of escalated during the pandemic. And I see a lot of adolescent girls, and they say, you know, we do need to have those conversations with our teachers and our parents and our peers. So thank you for speaking to that as well. Dr. Jack Olwach is the acting CEO for Kenya Medical Training College, collaborated with Beyond Zero, you know, to offer training opportunities, which is incredible. And in what ways has KMTC's partnership with the Beyond Zero initiative contributed towards bridging the gap of human resources for health towards universal health coverage?
Thank you, Janet, Your Excellency, the First Lady. Thank you for the opportunity of inviting us to be here today. KMTC, that is Kenya Medical Training College, is a model institution in training health personnel in this country. KMTC today trains over 90% of the health personnel you'll find in any facility in Kenya. KMTC has really benefited through the partnership with Beyond Zero. To date, KMTC has trained 1,200 ECN graduates through this program. And what is important is the bridging of gap in health personnel or workforce in arid and semi-arid areas in this country. We have 20 ASAL counties. And one of the challenges that has always persisted in these areas is maternal, newborn, and child health challenges, access to care. And the partnership between KMTC and Beyond Zero has helped this nation bridge that gap. What we are talking about is up to now 1,200 trained. We have 124 on training because of Beyond Zero and Roche. And World Bank has also played a role in this, to this end. Out of this 1,200, 600 of them are now employed by counties in arid and semi-arid areas in this country. Now, what is the impact of that? Number one is the aspect of primary health care in this country. We want to talk about sanitation, and this plays a big role because these health workers actually interact with the community. They participate in activities in the community. Janet, what we are talking about here is immunization, one of the major areas where we need to go to in order to prevent infection. What we are talking about here is infection prevention, education of the community. We are talking about access to healthcare. And what we are talking about here is mothers being able to visit dispensaries, at least 4 visits before they deliver. we are talking about delivery, skilled delivery in a healthcare facility. We are talking about after delivery, the immunization of these children, making sure that we do not have children dying before they reach the age of 5. What we are talking about here is how human resources for health has improved because of partnership with Beyond Zero. And I want to thank the First Lady sincerely, because we are beginning to see outcomes and a lot of impact of this program in terms of healthcare services at primary healthcare level. Thank you.
Thank you. Thank you. And perhaps when we come back for the recommendations or call to action, we could also speak to how to scale the already existing numbers and how we can maximize on the impact of that. So thank you so much. Edna Talam Kimayo is the CEO of the Nursing Council of Kenya. And these awards really recognize the frontline role of nurses in the provision of primary healthcare. Very necessary awards, very progressive as well. What is the Council's experience in providing relevant curriculum and continuous professional development courses?
Thank you, Janet, and Your Excellency. Much appreciations from the nursing fraternity. We are really grateful for these recognitions and the honor that we have. So touching base, Janet, in regards to what you've asked, and quickly recap in our training. The training for nurses and midwives in this country really focuses on 4 competencies: the general nursing, the community health, the mental health and psychiatric, and midwifery and reproductive health, where now the Beyond Zero really sits in regards of achieving its own. So basing on that nature of the training, and in addition again to the scope of our practice and even the unique role that we are placed in ensuring that we provide the healthcare services at every level facility, we are in a unique situation to ensure that we direct the care. And at the same time, again, we also ensure that we focus on the primary health care for us to be able to ensure that we also promote the health inequalities that we've been able to see within our country. So Janet, again, coming back in regards to the curriculum and continuous professional development. So we based in regards of the council directing the syllabus, which is a guidance for the all training facilities, including the KMTCs, universities, to ensure that the basic minimum standards are be able to be adhered to. I'm happy to report that the skills and the competencies our nurses and midwives are able to have been able to be transferability to the global space, and that is where we are even seeing the recognitions of nurses and midwives within the globe. But again, going in regards of ensuring that what is then the future holds for us, it is quality improvement, and that is us to really focus on competency-based curriculum. So we are really detaching ourselves from the content-driven, but ensure that it is competency-based training for us to focus more so on the primary healthcare service delivery. So pointing on that, then it calls now for us to be able to see then, once we are able to develop this curriculum, we've been able to provide what is necessary. So it's focusing first beyond the content, that is the competencies, but then how then do we be able to deliver? So call for investment in regards of ensuring our facilitators. So we no longer want to see lecturers, but we want to see facilitators going in to be able to facilitate that. But again, as we also think about these competencies, we are also ensuring that we provide the communication aspects, which provide the soft skills, the change of our behavior, the change of our attitudes, and what our patients and our clients want from us. In addition to that, we're also leveraging on technology, ensuring that the content delivery also provide a blended approach, both e-learning and at the same time, again, the skills enhancements. So going back to the clinical placement is also ensuring that within our clinical placements, because it is hands-on skills experiences, that we have the requisite requirements which are there, and appreciation to the directors for nursing CNOs who are here, because once we facilitate our students, provide them with the content in class, we also send them with the clinical placements where now they need to be able to provide leadership in that. And so by and large then, again, is that we also are rallying on a competency-based framework where we need to be able to retain the nurses, the specialists within a clinical area, for them to be able to provide that support to the students by large. And at the same time, again, within the scheme of service and also the scope of practice, that we are able to attain these clinical placements within that. So the delivery is a continuous and now calls for multi-stakeholders approach, the collaboration, the partnership for us to ensure that the success of this delivery is that. And as I finish, Janet, again, in regards to the CPDs, that is continuous professional development, the council is really keen to ensure that the compliance is done by that. and ensure all the nurses and midwives are able to maintain their competencies, their skills, their knowledge in their day-to-day practices. And a lot of platform has been offered, and thanks to all the partnership and all the people that they've actually been able to come both internationally and locally to ensure that we are able to deliver this CPD online, so that our nurses and midwives does not need to be able to leave what they are doing on a day-to-day basis, but are again able to have that access for the competency that they need to do.
All right. Thank you. Thank you for that comprehensive insight into the specific ways to address that. Peggy Gruninger, who is here as the head of Roche Corporate Donations and Philanthropy, been a key partner in ongoing programs to train more nurses from the arid and semi-arid lands as well. Talk to us about how Roche has impacted on communities insofar as coverage, insofar as quality, and insofar as availability of health services.
Your Excellency, honorable guests, I'm really very excited to be here.
You can hold
today.
it a bit closer to you so that we can hear you. Yeah.
I'm really very, very excited to be here today. It's an honor for me to be able to share what Roche is all about. For people who do not know Hoffmann La Roche, this company has existed for more than 125 years. And for philanthropy, that's my responsibility as the head of philanthropy at Roche, this has existed for over 100 years. Roche does philanthropy in countries, in places where the people that are doing philanthropy to shine do not go. So we go to those places where we select our partners very, very carefully to ensure that this partnership is about making a difference for the people on the ground. To the nurses who have been singing here today, I'm really excited to see all of you. My background is in nursing. I graduated 39 years ago, so it's incredible. And I went on to become, a clinical science specialist and all that. I live and I work in Europe and Switzerland. Healthcare is not of any value if it's totally removed from the people. You can have the best innovative care, you can have the best, but if these activities that you create, all the benefits of medicine that you create, do not reach the patients, it has no value. Our partnership with Beyond Zero is one of those partnerships where we looked very closely to say, what is Beyond Zero standing for? We only partner with organizations that are best in class, innovative, doing something that is going to be impactful for the people on the ground. So when I talk about this kind of partnerships, when you look at, 2 days ago, I met one of the students that is coming from 650 kilometers away from Nairobi. This is for me where impact is needed. We know in Africa in general, our doctors are scarce. Some of them, we have a problem of brain drain, they leave the countries, they go abroad because it's more attractive. So we have to think of ways, and that's what Beyond Zero is doing with our partnership, to go to those remote places, to train people for community, to train the community caregivers. The community caregivers are very, very important for primary health care because they are in their own communities. They speak the language. The people understand them. They build trust. So when Beyond Zero gives them, the tools to be speaking the medical language that will be understood by their people, they build trust. So by the time someone has a diagnosis that needs medical care, the community health care giver can refer them and they can accept, because acceptance is also key for treatment. Because, for instance, diseases like cancer, we in Africa in the past thought this is something, a curse, something like that. To take away the stigma takes the community caregivers to talk to the people to say, if you are diagnosed with cancer today, it's not a death sentence. You can be treated. And then refer the people to those big hospitals, to the clinics, to those places. And then the people trust because their people are treated and they go back. We have HIV that's very prevalent and all over Africa. In the past it was much more stigmatized. Now through Beyond Zero and other partners, the mothers know that if they admit their status to their healthcare givers, they have a chance that they are not going to infect their babies. And this is a huge change. And this only comes when we partner with community caregivers. So I'm really, really pleased to be here today. And I really applaud all the nurses and everybody that's working in the healthcare sector. Behind each and every patient, there is a fleet of nurses who are giving their best to make a huge difference for patients. Thank you so much.
Thank you. Thank you so much. We'll come back to a final round of questions. I also know we have a community watching us online. Please engage with us. Share in the spirit of what today stands for, which is key learnings, but also recognizing nurses and midwives who just play such a critical role. As Peggy said, behind every patient, there's a fleet of them. And so please engage with us using hashtag celebrating nurses. And let's just keep the conversation going. We'll be rewarding them very soon. And so we'll come to that part of the program. There's been some really interesting learnings, I think, from this panel. There's been, and in some ways, it also speaks to values. You know, you spoke to having the conversations. I know you spoke to the numbers and the trainings and how that has played a big role. You spoke to the trusting healthcare workers to be able to, I guess, take you through to the next level of the treatment. And so now I think is a great time to get some key recommendations from you, which I know is a tough one because there might be many. But given that we have the attention of the country, the public, our partners, and distinguished guests in the room, from where you're sitting, what is that one recommendation? What is that one call to action that you feel can really change the way we're working with and trying to change universal health coverage through primary health care? Just a call to action, briefly, just in the interest of time for all our panelists. Starting with you, Stephen.
Well, thank you again, Janet. And I'm going to zoom right back out and say that delivering primary health care for everyone in Kenya is urgent, and it's vital as a foundation for sustainable development. It's a big lift, but it's absolutely doable. We know how to do it, we just need to do it. And to do it, we need everybody pushing in the same direction. So my call for action is that we, all of us, public, private, national, county, international, we need to redouble our efforts to come together. We need to redouble our efforts to give birth to very creative, strategic, public-private partnerships that just get on and do it. And you have our personal pledge from the UN through our public-private partnership platform that we're there to help.
Thank you for that. So a call to action to mobilize more and do it urgently. Thank you so much. What about for you, your call to action with regards to how we can move this conversation forward?
Thank you very much, Janet. I think for me, I think leadership, commitment, resilience, and partnership is what we've learned from this journey of our excellency partnering with all of us. And most importantly, running. I know when you speak about running, we just remember Her Excellency just running, but that running is what is a call to action. The fact that we can actually change the way we do things, the pace through running. I want to just share with you, the reason I'm calling this as a commitment, when we started a partnership through the National AIDS Control Council with Her Excellency, our numbers for mother-to-child transmission was so high, it was around 17%. And just within a year of this partnership, by the second year, we are at around 8.7%, and we were so hopeful through the nurses of this country that we were going to get the target. And that's why I think that as we celebrate these nurses, the conversation about mother-to-child transmission of HIV can never happen without the nurse. Our nurses, our first entry. Pregnancy diagnosis, HIV diagnosis, it is our nurses. So unfortunately, even when we get a nurses strike in this country, those figures just change. Your Excellency, when we got a nurses strike, we just saw what happened. We never were able to diagnose mothers. We were never able to give the services that we wanted to give for just a prolonged nurses strike. And so the call to action is to recognize the nurses, but also to ensure we never again have a prolonged nurses strike, because it's actually the primary health care model where it starts. Thank you very much.
Thank you for that. And for using running as a symbol for the pace that we need to pick up when it comes to that. Thank you. Dr. Jack Oluwatch, what about your call to action?
Thank you, Janet. My call to action is collaboration and partnership.
Okay.
To this end, Beyond Zero, Roche, and the World Bank has contributed 1.113 billion towards training of enrolled community health nurses. And we are talking about 1,200 trained enrolled community nurses. But out of this, Janet, 600 have been employed by the counties where there is great need, that is ASAL counties. There is a gap that must be filled. After training, we need to get these health workers to the ground, and counties play a very big role. We are in engagement and communication with the counties through the Ministry of Health, and I'm very glad our PS is here. She presided over our graduation yesterday, where we churned out 5,150 more health workers. But we must look for a way of employing these nurses. They must provide that service where it is greatly needed. We must find more funders to be able to take needy students through training. We have many needy students knocking at our doors, requesting to be trained, but we do not have sufficient funds to do that. Most of these students come from very, very poor communities where health care is needed most. But without the impetus and the initiative to fund training, then it remains a pipe dream. So it is necessary to have partners who can work with us to be able to bridge this gap. We are actually asking to add 10 more campuses to train this cadre of specialty. But that cannot happen without partnerships, funding for training, counties employing the people we've trained. But as KMTC, we want to say we are committed to quality, and we will provide the best training that is suitable for primary health care on the ground. Thank you.
Thank you. A call to action on collaborations and further investment. Edna Talam as well, briefly, a call to action. You spoke to it briefly, but how can you, what really would be the recommendation that you feel can scale the support?
Thank you, Janet. Really being a passionate in nursing, and myself being a nurse and a midwife, we've actually seen in COVID how nurses was able to provide that care, the resilience we have, the passions we have in our professions, and the commitment we have to provide service. So in regards to that, then the call for action is basically on investment in two aspects. The first one is investment in competency-based training, investment in ensuring that we employ them and remunerate them so that we can be able to retain them. And at the same time, in the training, again, to go beyond the specialization, ensuring that we go and have advanced nurse practice and advanced nurse midwives to be placed in the community. And finally, at the same time, again, ensure that we provide the correct leadership. We enhance the leadership at every level, whether it is a clinic, whether it is a unit, whether it is a division, so that the nurses can be able to direct the care. And all this ensures that we deliver the primary health care that will be able to promote and improve access to care at every level, and also making health care affordable. Nurses and midwives are able to make health care affordable in our country.
Thank you for that, Edna. And finally, Peggy, your call to action.
My call to action is very simple. I would like to say to everybody in a position of influence, whether you are working for the healthcare sector, whether you are a funder, a partner for Kenya, for the government, for Beyond Zero, we are all patients. You might not know your status today. So imagine in your mind, if tomorrow you get your diagnosis, you want to be able to say, I am taken care of in Kenya. For that to happen, you have to contribute. The beauty is that everybody can contribute by making sure you really honor the responsibility you have been given to make sure nurses are well trained, that the healthcare system of Kenya is robust and stable, so that when you need that care, you can be proud to be Kenyan and have access to the best care possible. So for me, that's the call to action. Everybody take responsibility. Thank you.
Thank you. Thank you for that. Thank you to all of you for giving us a lot of food for thought, for challenging, for already doing such incredible work, but saying if we collaborate, if we invest more, if we come together more, if we see ourselves as patients who need access to these health centers and take on that responsibility, then we can really scale how the primary healthcare is delivered. So thank you. A round of applause to our incredible panelists. Thank you so much. I'll invite you to return to your seats so that we can continue with the program today. And yes, you can please return to your seats. Thank you so much. And I'll be calling upon June as we get the stage cleared. Thank you so much. June will make an announcement and then I'll be right back.
Can we give another round of applause? Thank you, Janet Mbugua, for moderating the first program. At this hour, Your Excellency, the First Lady, as we wait for the second program to come back on stage, allow me to invite Mashujaa Africa Band by Kathy Kirago to give us some interlude of music. It's a love.
Thank you so much for that wonderful interlude, and we'll be coming back to you once again. We continue with our program now, Your Excellency, distinguished guests. I'd really like to recognize the nurses and midwives and CNOs. Can you wave? There you go. Thank you. Thank you. I know a lot of you have come from so far, and we'll be getting to that very, very soon. In the meantime, there is somebody who couldn't be here to make her remarks, and so I'll ask us to turn our attention to the screens for Professor Margaret Crook's speech, Department of Global Health and Population, to share some remarks.
Good day, everyone. My name is Professor Margaret Crook, and I am so pleased to be part of your Beyond Zero Summit. Thank you so much for inviting me. I'm here to talk about the emerging science on reducing maternal and newborn deaths. And this is a science that the country of Kenya is leading through leadership of the Ministry of Health, the First Lady, the Council of Governors, and some very brave pilot counties. I want to start by noting the huge improvement that Kenya has made in maternal and newborn health over many decades. In fact, maternal and newborn mortality have declined quite dramatically, and at the same time, access to healthcare services, and particularly delivery services for mothers, has improved. And yet, over the last several decades, Kenya, along with many neighboring countries, has faced a reduction in that improvement, has faced a stagnation in the mortality reduction. That means that we still have too many babies and moms dying of preventable deaths in health clinics, not just at home. And so the question is, what can be done? What can we do? What can you do to avert this remaining maternal and newborn mortality? Well, our group, together with the government and the First Lady's team, have looked closely at what the causes of death are and what the opportunities for improvement might be. And we find that in your country, as in many countries in the sub-Saharan African region, many mothers, in fact up to 1/3, deliver at the primary care clinic, whereas another 40% or so deliver in hospitals, with the remainder delivering at home. When we compare that pattern to the pattern in high-income countries and in well-developed health systems, we see that all mothers in those countries deliver in high-quality hospitals rather than primary care clinics, and very, very few deliver at home. And so the question to ask is whether Kenya is ready and able to move deliveries from home and from primary care facilities all the way to the hospital. And this is where the emerging science begins. What we know is that although we have been reserving hospitals for high-risk women, any woman and any baby can become a high-risk patient, because complications of labor and delivery can arise without any warning, as most of you in the audience know. We also know that although we talk a lot about referral when complications arise at the first level clinic, the reality is very different. It's actually quite difficult to refer someone from a primary care clinic to a hospital in the time that it takes to save a life. When we look across your country, the question is, are there sufficient numbers of hospitals to be able to accommodate the women that need to be delivered? Well, that's a tough one to answer without looking within the county level. And so here we can see in Kakamega County, the county that is piloting service delivery redesign, that that county does in fact have a large investment already in hospitals and health center floors, such that they could be expanded to accommodate all of the deliveries in the county. We further see in Kakamega, but in many regions of Kenya, that many women live within 1 or maybe maximum 2 hours of a hospital. And with sufficient support, with transport, those women can reach the hospital without having to stop at a primary care clinic first. When we look at the options available in Kakamega, therefore, we see that there are sufficient numbers of hospitals to be able to deliver women. And we see that the knowledge of health providers is higher in hospitals than in primary care clinics. We also see, when we talk to women and their partners and midwives, that many midwives are very well aware that saving a life in a primary care clinic is extremely difficult, that she doesn't have the resources, the technology, and the team to assist in such a dramatic complication. And many of them would prefer to work in teams in the hospital setting. Bringing these factors together, it seemed to us feasible, and more importantly, it seemed to the government of Kakamega feasible to try to concentrate deliveries in health center 4s that are upgraded and made to provide both humane and high quality care. Once we do this, improving primary care centers, so health centers 2 and 3, to provide antenatal care and postnatal care only and not delivery care, has been determined as the way to go. Many women and some women in the county will require additional supports with regards to access to the hospitals and may be requiring support at night in particular. We know that hospitals are not perfect, and this kind of transformation of delivery care from the first level, primary level, to the hospital level cannot happen overnight. Those hospitals and those staffs have to be upgraded, and they have to be retrained to provide the highest level of care. And yet, we think that service delivery redesign, a focus on excellent care, humane care for every woman, for every delivery, every time, is the way forward in Kenya and Kakamega. I'll leave you today by just saying how impressed we are with the government of Kenya for taking on a new model of care, for testing a delivery model that is already adopted in much of the rest of the world, and for being brave enough to intentionally design the health system to benefit the lives of women and newborn. And we couldn't be more pleased to be with you today, even though remotely.
Okay, those remarks there from Professor Crook, again speaking to really incredible milestones and even highlighting how Kenya is already role modeling in the way they're designing healthcare to reach those furthest left behind. But as the professor said in the video, any one of us could be that critical patient or could scale to be a critical patient. And so this really applies to everyone, every single one of us, those left furthest behind and those who also have access. I'd now like to invite His Excellency Ambassador Zhu Pingyang from the Embassy of the People's Republic of China to come and make some remarks today. They've also been very supportive of the Beyond Zero initiative. So let's welcome him.
Excellency Margaret Kenyatta, the First Lady, Excellencies, distinguished ladies and gentlemen, Hamjambo. It is my great honor and pleasure to join you in the Beyond Zero Summit today. I thank you very much, Your Excellency, for your kind invitation. 100% universal health coverage. That is going to be some remarkable achievement. 100% UHC by 2022. That is going to be some remarkable achievement for the government and the people of Kenya. It takes hard work, good work. And as your friend, I can tell all of you are working very hard to achieve this goal. So congratulations. Hongera kwa kazi nzuri sana. We all know health matters. Healthcare matters. So no wonder it is in the Kenya Vision 2030. It is one of the big four agenda, and it is a priority for China's cooperation with Kenya and Africa. Early this week, on Monday and Tuesday, the 8th FOCAC ministerial meeting, Forum on China-Africa Cooperation was successfully held in Dakar, Senegal. President Xi of China announced 9 programs to promote China-Africa cooperation in the next 3 years. You can imagine the poverty reduction and rural development, trade and investment promotion, green development, digital innovation, capacity building, peace and security, culture and people-to-people exchange are on the list. And top on the list, the first of the 9 programs President Xi announced in the meeting is the medical service and health program to support African Union's efforts to achieve its goal of vaccinating 6% of the African population by 2022. China will provide another 1 billion doses of vaccines to Africa, including 600 million doses as donation and another 400 million to be provided in such ways as joint production between relevant African countries and Chinese companies. And in addition, in the next 3 years, China will undertake 10 medical service and health projects for Africa. China will send 1,500 medical staff and public health experts to Africa. China and Kenya are good friends, good partners, good brothers, good sisters. Our cooperation and mutual assistance in the fight against the COVID-19 serves as a prime example of solidarity in the face of a disease. So moving forward, China is firmly committed to deepen its cooperation with Kenya in the health sector and all the other areas to bring more tangible benefits for the people of both countries. I thank you very much. Asanteni sana.
Asante sana, His Excellency Ambassador Zhu Pingyang, for those remarks. Very soon we'll be moving to the celebratory part of this event, where we'll be recognizing nurses from across the country represented in this room here today. Some have come from very, very far away, and I'm looking forward to those celebrations. And we'll also be hearing from Her Excellency to make her remarks very shortly. I just also wanted to add that I've been sitting here thinking it's really this simple. For the nurses and midwives, there is no us without you. And I think we need to validate you. We need to really celebrate you. Because as some of the speeches have mentioned earlier, during the pandemic, it's been a trying time. You really have been the bedrock of the country in transitioning us to where we are now. So we honor you, we validate you, and there is no us without you. I'd now like to invite Honorable Professor Anyang Nyong'o, Chair, Health Committee, Council of Governors, to make his remarks. He will then invite our other keynote speakers for this event. Please let's give him a round of applause.
Your Excellency, the First Lady, Mama Margaret Kenyatta, and the Beyond Zero patron, Cabinet Secretaries present, county government representatives, and Your Excellencies, ambassadors and High Commissioner, particularly my dear friend Zhu Mengchun. I think in my previous life I must have been a Chinese. My name is almost like that. My dear friend Stephen Jackson from the UN, Minister of Health representatives of other development partners, health workers present, particularly nurses, distinguished guests, ladies and gentlemen. I think the Chinese nation is about 1,000 years old or more. The Kenyan nation is about 60 years old. So unlike my friend Zhu Bingqian, I will read my speech. We are gathered here today, First Lady, not only to celebrate Beyond Zero Summit, but also to acknowledge the impact of this program on the health of mothers and children. On behalf of county governments, may I take this early opportunity to congratulate and thank Her Excellency the First Lady of the Republic of Kenya, Mama Margaret Kenyatta, for a sustained commitment to improving maternal and child health outcomes across the nation through the Beyond Zero initiative. This initiative has been ambitious, working closely with county governments and other stakeholders to ensure that all Kenyan mothers deliver safely, their children are born healthy, and that under 5 mortality is eradicated. It also strives to ensure an HIV-free generation with zero mother-to-child transmission of HIV. Ultimately, the initiative strives to ensure that no mother should die while giving life. We hope that the initiatives currently being undertaken in Samburu County to reduce the rather high transmission of HIV from mother to child will succeed and consign this phenomenon to the dustbin of a forgotten past. County governments have worked closely with the Beyond Zero initiative since its inception. We have received support in various ways, including through the fully equipped Beyond Zero mobile clinics that were supplied to all counties. Beyond Zero campaigns and outreaches continue to take comprehensive healthcare services to communities in far-to-reach areas, helping bridge the gap between communities and health facilities. It is key to note that county first ladies joined this cause and help cascade the Beyond Zero initiatives further within counties. Today, we appreciate the role they have played in ensuring the results of this initiative reach even the furthest of places, as we have heard this morning. Some places are far away from Nairobi, at 600 and more kilometers. Initiatives like these, ladies and gentlemen, can drastically spur positive change within our communities and to contribute to much needed health outcomes. We therefore need to continue maximizing the opportunity that initiative continue to offer across our counties. Your Excellency, ladies and gentlemen, I have watched you participate in the Beyond Zero First Ladies Half Marathon and put to test both your endurance and stamina for purposes of mothers and children. Next time, please invite me to the Beyond Zero Quarter Marathon. This clearly highlights your unwavering commitment to improving maternal and child health outcomes across the country. Indeed, your commitment on this issue was first demonstrated through the rollout of the free maternity care program, and later through your ambitions to achieve universal health coverage under the Big Four agenda. Having been a county that was piloting universal healthcare, I know the pitfalls and opportunities that universal healthcare offers to this nation. And I hope as we go forth that it was not just an experiment, but something that Kenya will implement today and beyond. Today, I would like to note that we have made significant progress in maternal and child health outcomes, improving child immunization coverage, antenatal care, deliveries under skilled healthcare workers, and the overall improved survival of both mothers and children. And this because health services at the sub-county and healthcare centers has improved tremendously since the evolution started. Progressively, our motto, no mother should die while giving life, is coming alive. Our investments are bearing fruits. Ladies and gentlemen, just like running a marathon, we need to be ready for sustained investment in healthcare to reap ultimate benefits. We acknowledge that we still have some challenges around maternal and child health, and indeed in the delivery of healthcare at both county and national levels, issues like adolescent pregnancies, sustained high level of infectious diseases, emerging non-communicable diseases, and the COVID-19 pandemic remain problems in our nation. But as we do so, it is important to acknowledge that the progress we have made in the past decade in regard to health has perhaps been the biggest in Kenya's history. Having been a Minister for Medical Services, I know that progress has been made sustainably over time. If we sustain this path, we will be able to achieve universal health care for all by the year 2030. Your Excellency, we thank you for your continued support to county governments. Counties continue to be central pillars in healthcare delivery services, investing up to 30% of their total county budgets in health, despite having 14 other devolved functions. These resources continue to strengthen health infrastructure across the country, equip health facilities to offer both basic and specialized health services, recruit health workers across all cadres, and improve health service delivery. Counties have embraced primary health care in the collective goal to deliver universal health coverage. We are also putting emphasis on community health services so that we keep our communities healthy. All these go a long way in supporting maternal child health within communities. Indeed, community health volunteers, which my county are called community health workers, have been a pillar in the development of universal health care in our nation. Your Excellency, ladies and gentlemen, we have also learned a lot from the COVID-19 response and mitigation, much as this pandemic presents one of the most difficult health challenges of our lifetime. We have acknowledged the role of preventive health in the health sector, but also we have seen firsthand the great commitments and dedication our health workforce has to this country and our communities. As such, these remarks cannot be complete without appreciating our health workers, who continue to be frontline soldiers in matters of health, particularly our nurses and other community health workers at the basic level. County governments place great importance to our health workforce and continue making significant investment in this area, both in terms of numbers as well as skill sets. Today, we have health workers stationed far and wide across our counties, providing high-quality health services to our communities. We need to sustain this investment in human resources for health so as to reach the optimal number of health workers given our population. And as previous speakers have spoken in their panel, telling us exactly what these optimum numbers should be. I appreciate the critical role played by our nurses, some who are here today, for being dedicated and committed to their work and in supporting the First Lady's Beyond Zero initiative. To our health workers, this is your day. We honor and celebrate you. We note with appreciation the commitment and resilience that you have demonstrated as first-line soldiers in the fight against the COVID-19 pandemic. Today, the Beyond Zero Summit is officially recognizing the contribution of nurses and midwives in primary healthcare. As you know, primary healthcare is a very important step in achieving universal healthcare coverage. May I therefore take this opportunity, ladies and gentlemen, to congratulate you winners. Congratulations. I hope that we can extend these health awards to other healthcare workers in order to spur holistic improvement across the sector, including at community level, where community health volunteers work. Nay, not volunteers, workers, because they do a tremendous job and should be recognized as such. Prevention of diseases, creating linkages to health facilities, protecting life, this is indeed a major responsibility that these community health workers do. No mother should die while giving life. No mother should die while giving life. That is indeed a motto that we should wear like a lapel on our shirts and coats. Thank you very much, ladies and gentlemen.
Thank you so much for those remarks, Honorable Professor Anyang Nyong'o. It is now my honor to invite the Chief Administrative Secretary, Dr. Mercy Mwagangi, to come and give us some remarks before our chief guest speaks. Karibu sana, let's give her a round of applause.
Thank you. Your Excellency, First Lady of the Republic of Kenya, Margaret Kenyatta, and I say today, Shujaa wetu. Okay, I will indulge and remove my mask, Your Excellency. Thank you. Shujaa wetu, mchapakazi, as they said in the song today. Your Excellency, Governor Prof. Anyang Nyong'o, who is an expert in UHC and continues to guide us as we chart that journey in the country. To Ambassador from China, a friend of us who continues to support us, thank you so much for that. Steve, a worthy partner, a passionate partner for the government, thank you for that. My Principal Secretary, Susan Muchache, who took me to the first Beyond Zero Marathon. She did 10 kilometers. I did 2, Your Excellency, like our president, and I'm improving and working on that. Thank you so much, Your Excellency, and Connie, a dedicated and passionate Chief of Staff, and really, I think I heard you say the legacy. It is your legacy, both of you, with the First Lady. Thank you so much for inviting us here today. We are pleased to join you. I'm standing here on behalf of my cabinet secretaries, Senator Mutahi Kagwe, who was not able to make it today, but he sends his regards. And he says that Beyond Zero Summit really is an important summit. It brings together policymakers, leaders, and key stakeholders in the health sector. And the ministry would like to take this opportunity to express its sincere gratitude for your championship for primary health care. Indeed, we can never reach universal health coverage goals without taking health closer to the people. And this year's Beyond Zero Summit objectives are in line with the Kenya Primary Healthcare Strategic Framework 2019 to 2024. And as we gather to review the latest evidence on primary healthcare investments, the role of nurses and midwives in driving primary healthcare is absolutely crucial. Your Excellency, as we reflect on the importance of effective primary health care on maternal and child health outcomes, We would like to take this opportunity to most sincerely appreciate the nurses and the midwives for their commitment and service in this area. I would like to add on a slogan to Janet's slogan, that indeed all of you nurses, the reason that we are is because you are, and we thank you so much. Kenya has made a significant progress since 1978 when it comes to primary health care. And Your Excellency, some of the initiatives that have been taken place to strengthen primary health care include the Linda Mama program. This program has contributed to the increase in skilled birth deliveries. As an example, we've increased from 57% to 78% in 2020. And in addition, we see more mothers attending the first antenatal clinic by up to 18%. The Ministry of Health remains committed to ensure all Kenyans across the country access health, and we bring health closer to the people. As Governor has highlighted, a lot remains to be done. A lot has been done with county governments in ensuring that healthcare is more accessible for Kenyans. And of course, nurses and midwives serve as key service providers whose commitment to eliminate, amongst many things, mother-to-child transmission of HIV, promotion of maternal, newborn and child and adolescent health has been witnessed across all health facilities. And additionally, in the HIV program, again, we have made gains by ensuring that AIDS-related deaths have been reduced by 67% from the year 2013 to 2021. Your Excellency, the Beyond Zero initiative has made a major impact on service delivery for mothers and infants in the country. We are told you were alarmed by the statistics at the beginning of this journey, and we are glad to have partnered with you and to have contributed to now the reducing statistics when it comes to child mortality and maternal mortality. We have witnessed your commitment to this cause with love and admiration, the donation of the mobile clinics to counties, as well as supporting outreach programs that have promoted access to ANC and immunization services. Your Excellency, I would like to take this opportunity on behalf of Kenyans to appreciate your championship, to say you are a true Shujaa, and to thank you for all the work that you've done over the past years in this program. And it is now my distinct and humble pleasure and honor to invite Mama wa Taifa, Shujaa namba moja, mchapakazi, Her Excellency Margaret Kenyatta, the First Lady of the Republic of Kenya, to make her remarks. Karibu.
Thank you so much. Please be seated. We've been blessed with a lot of rain. Distinguished guests, ladies and gentlemen, I stand before you filled with gratitude, anticipation, admiration, and pride. I'm grateful to everybody here and the countless across the country who are watching for your tireless work to improve the health and well-being of women and children. I'm proud to be hosting the second Beyond Zero Summit to appreciate the incredible advances that your work, our collective work, has secured. It's been a journey of passion, energy, and boldness that has kept us on track since 2013. It's a special day for Beyond Zero because it gives me the honor and privilege to recognize and appreciate the role of our health workers, especially nurses and midwives, for their outstanding accomplishments in communities in which they serve. To me, you are all winners. The theme of this year's summit, increasing investment for primary health care, resonates with investments we have made to help us forge stronger, more equitable, more accessible health care for all. I admire and deeply respect the healthcare stakeholders for the innumerable sacrifices you make on a daily basis to move our country forward. I strongly support your belief in a future where the lives of all Kenyans, especially women and children, count. The theme of the summit also reminds us that good progress has been made on all fronts, and we are well on our way towards the achievement of universal health coverage and the Sustainable Development Goals. Over the past year, we have experienced the devastating effects of the COVID-19 pandemic. As a result, we have come to appreciate the importance of a strong health system that includes a robust workforce at primary level. We continue to focus on reducing and eliminating mother-to-child transmission of HIV and syphilis in order to achieve our path validation by 2022. Our commitment towards the elimination of social injustices against women and girls, including female genital mutilation, by 2022, and ending all forms of gender-based violence by 2026 remains a priority for the government. We need to invest more in prevention of diseases and to advocate for healthy lifestyles alongside delivery of quality health care at community level. This is where the real change happens. Diversity and inclusivity remain fundamental to Beyond Zero's work. Today, we observe the International Day of Persons Living with Disability. This day has been set aside to reflect and increase awareness on the importance of inclusivity and access to services for all persons in society. Under the theme Leadership and Participations of Persons with Disabilities Towards an Inclusive and Accessible and Sustainable Post-COVID-19 World, we are reminded of our collective commitment to do more to ensure that we leave no one behind. To this end, I urge for increased investment in registration and data collection mechanisms to advance our efforts for inclusivity. In addition, I firmly believe that partnerships are about finding ways to complement
Ili kupata sikiza tune hii ya Romans chapter 8 verse 39, bonyeza star 811 star 965 hash.
No power in the sky above or in the earth below, indeed, nothing in all creation will ever be able to separate us from the love of God that is revealed in Jesus Christ our Lord. Romans chapter 8 verse 39.
Ili kupata sikiza tune hii ya Romans chapter 8 verse 39, bonyeza star 811 star 965 hash.
For accepting my invitation to the Beyond Zero Summit. Thank you for joining me, and may God bless you all.
Can we give Her Excellency the First Lady another round of applause? Thank you, Your Excellency, for that wonderful speech. Thank you. You may all be seated. Thank you. We are coming to another stage of our program. And at this moment, allow me to introduce the coordinator of the Beyond Zero, Angela Lagat, to come and now introduce to us the finalists and the reason why we are here today. Ladies and gentlemen, let us put our hands together for Angela Lagat. Welcome, our coordinator of the Beyond Zero.
Your Excellency, Cabinet Secretaries present, Excellencies and distinguished guests. Before we do my part, allow me to draw your attention to the screens for a documentary that we've prepared. These shots are around all the places we've been, and I hope you had an opportunity to look at the gallery. So this is for the nurses and the midwives of Kenya. Karibuni.
Tuna imani kwamba wanachofanya ni zaidi ya kazi, ni heshima kuu. Katika nyakati za ukosefu wa uhakika, wao ndio sisi wategemea kupata tumaini na uponyaji. Tunaweka imani yetu kwao tukitegemea watutunze sisi, familia zetu na jamii zetu. Na zaidi ya wito wa kujipa kikazi kwa bidii na kujitolea bila kuyumbayumba, wao hutoa huduma. Tuna imani kwamba wanachofanya ni zaidi ya kazi, ni kujitolea, ni himizo, ni wito wa kuendelea mbele zaidi bila kujali chochote kinachoikabili jamii. Wao hubaki wamejitolea kuitikia wito wa kutuhudumia na kututunza sisi. Tunawaheshimu na kuwaenzi wauguzi wetu. We honor and celebrate our nurses kila siku na siku zote.
Nafurahia huduma ambayo nurses wa Kenya wanatupatia.
Thank you, Excellency. Those are nurses who've been supported by the Beyond Zero Scholarship Fund. Allow me to take you through the process of the Health Awards, Your Excellency, and how we got here. Nurses are the first point of contact with the Kenyan health system for most patients. In recognition of this, and to complement government efforts in health system strengthening, the Ministry of Health and Beyond Zero established a 2-year scholarship for the enrolled community health nursing training program in 2016. The first cohort of 1,200 students were funded by the World Bank and trained by the Kenya Medical Training College. More recently, in 2018, an additional 124 students were funded by the Roche. Students come from arid and semi-arid counties, as well as vulnerable and marginalized groups of Kenya, such as the Sanye in Lamu, Ogiek in Narok, El Chamos in Baringo, Sengweri in Elgeyo Marakwet and West Pokot. To date, 1,070 students have graduated and are currently working in primary health facilities in the counties. The journey of the Beyond Zero Health Awards came from the work we have done through the enrolled community health nursing and the recognition of the critical role nurses play in our work. Today, Beyond Zero shall be rewarding their efforts. The awards have borrowed local and international best practice standards. The idea of the awards was conceptualized in 2021 this year and sped into action through a series of consultative meetings with health professionals representation across the country. This was followed by the development of criteria refinement with the Ministry of Health, Department of Nursing Services, the Nursing Council of Kenya, quality improvement expert, and key expert nurses who work with us during the Beyond Zero medical safaris. Criteria adoption and feedback from the counties were key drivers of the awards development and process. We held 2 pre-summit meetings attended by county directors of health and county nursing officers and led by the National AIDS Control Council regional HIV coordinators. The criteria was adopted on the 24th of June, and the call for application for the Beyond Zero Health Awards was announced on 5th of July 2021. The applications were purely online through the summit beyondzero.or.ke website. Only applicants from county public health facilities level 2, 3, and 5 were eligible. The application process. To attain the widest reach possible, multiple media were used to create awareness. This included bulk SMS through Airtel, Nursing Council of Kenya, and the Beyond Zero platform, social media networks, and the radio. Applications were closed on the 30th of July. However, recognizing the complexities of network access for interested applicants, a 1-week extension from the initial deadline of 23rd July was provided. A total of 10,497 applicants expressed interest in the Beyond Zero Health Awards. However, 2,285 completed the application process online. The nomination process. The nomination process for the semi-finalist process took place from the 14th of September to 2nd October and was county-driven. It included vetting by county nomination teams to verify the entry application forms. The process was rigorous, and the entries received varied per county. Upon completion of the nomination process, the counties then submitted a list of semi-finalists for the 3 categories: nurse practitioner level 2, Nurse Practitioner Level 3, and Nurse-Led Initiative. The semi-finalist process. 1,338 semi-finalists were submitted to the Beyond Zero Technical Working Group. Of these, the finalists were selected. The selection was guided by the scores awarded by the county nomination teams. In view of the COVID-19 restrictions and to adhere to the Ministry of Health, we could not invite all the finalists to attend, so their representatives, who are the nurses with the highest score per county, were nominated to physically attend this award ceremony. We've provided the Beyond Zero Awards book that outlines this process in detail in your conference bag. I thank you, and now I will request Catherine Kasabuli to come up on stage to take us through the award session. Thank you, Your Excellency.
Thank you very much. Switched on? My microphone, I need it switched on. I think I need it switched on, yes. Thank you. Thank you very much, Angela. Thank you very much, Angela Langat. Your Excellency, First Lady of the Republic of Kenya, Margaret Kenyatta, we salute you. Thank you so very much for this wonderful day. This is truly a mother. A mother nurtures, a mother cuddles, a mother embraces, and a mother infuses wisdom into the nation. You truly are a mother of the nation of Kenya. We salute you, Mom. Distinguished guests, the Diplomatic Corps, Ministry of Health officials, ladies and gentlemen, and of course, the ones we are celebrating today, the nurses and the midwives. Please, a big round of applause. We have now gotten to the climax of today's function, and ladies and gentlemen, today we will be showcasing the nurses who have traveled far and wide from all over the country, as far as Turkana, Lamu, crocodile infested areas. So these people sacrifice so much to go to work, to attend to people, to go to people's houses, little manyatas in Turkana, in Pokot, in Taita Taveta, braving weather like this, hyenas, elephants, anything you can imagine. So please, we love you so much. We really appreciate you. Clap for yourselves as we also clap for you. So 578 finalists of the Beyond Zero Health Awards, consisting finalists from the Nurse-Led Initiative and Nurse Practitioner categories. Well, on your screens, we have listed all the 578 nurses and midwives who are the finalists. All these 578 nurses are currently receiving an SMS right now from Beyond Zero congratulating them on winning. And beyond that, we also congratulate all the nurses all over Kenya. You are doing a wonderful job. Now, 47 nurses and midwives present, one per county, representing all the finalists, are here today with us. Now, I will be calling the 47 representatives out of the 578 finalists on stage with their gift in their hands. I will call all the 47 nurses to walk to the stage in line with these 7 regional clusters. So please be ready to welcome our wonderful nurses who have ensured that child mortality has significantly reduced in the country since 2013. And this we also applaud beyond zero. A big hand. So we'll start with cluster 1 and we'll do it a little quickly. Please be ready. Cluster 1, this is Kajiado, Kiambu, Kitui, Machakos, Makueni, Nairobi. Please come to the stage and don't leave the stage. That is cluster 1, Kajiado, Kiambu, Kitui, Machakos, Makueni, and Nairobi. Great. We now call cluster 2. This is Embu, Kirinyaga, Laikipia, Murang'a, Nyeri, Nyandarua, and Samburu. Our wonderful nurses. Please, a round of applause for them. Cluster number 3, this is Kilifi, Kwale, Lamu, Mombasa, Taita Taveta, Tana River, the crocodile-infested areas. Karibuni sana, tawapenda sana. This is Kilifi, Kwale, Lamu, Mombasa, Taita Taveta, and Tana River. Cluster number 4, this is Garissa, Isiolo, Mandera, Marsabit, Taita Taveta. I beg your pardon, Marsabit, Meru, Tharaka Nithi, and Wajir. Makofi. Another round of applause. Looking beautiful in their outfits. And now we go to cluster number 5. This is Bomet, Elgeyo Marakwet, Nandi, Narok, Uasin Gishu, Nakuru. Please move this way. Yes. Okay. Big round of applause for the Rift Valley. We now move on to Western Kenya. This is cluster number 6. This is Bungoma, Busia, Kakamega, Trans Nzoia, Turkana, Vihiga, West Pokot. Leave the podium. And last but not least, cluster number 7. This is Homa Bay, Kericho, Kisii, Kisumu, Migori, Nyamira, and Siaya. A big round of applause. They work tirelessly, braving floods, wild animals on the way, just to look after us and to help us give birth. A big round of applause, ladies and gentlemen. And now, ladies and gentlemen, they will remain on the stage as I call on the First Lady, Your Excellency, we would love for you to unveil the gifts for the 578 finalists at the table set in front of us right here. Please, a round of applause for Her Excellency.
The Governor's Vice President, kindly escort Her Excellency the First Lady. Cass, please. Let us escort the First Lady, Madam P.S. Let us escort the First Lady where she's going to officially conduct the launch. We have the Governor's spouses from representative of the 47 counties accompanied the First Lady as she unveils Zawadi. Makofi! Shangilia! As we celebrate all the nurses for the work they're doing and the winners of today's event. Continue. Let us give a round of applause. Oh yes, thank you. Thank you, Your Excellency. The First Lady is viewing all the gifts which the winners are going to receive. She's being led by the coordinator of the Beyond Zero, Angela Lagat, taking her through all the gifts. Her Excellency the First Lady will then proceed to the main dais. Welcome, Your Excellency. Of us kindly remain seated. Let us remain seated as Her Excellency the First Lady is doing a photo with the winners. I've requested them to take out their masks, and now we smile to the whole nation. Tuwapigie makofi tena. Asante. Those are the winners of today's event. Your Excellency the First Lady, before we come to other photos, I will kindly request you to take on your seat as we run something on the screen. And the rest of the nurses kindly. Ya tushuke chini kidogo ili Mheshimiwa Mama wa Taifa aweze kuona kitu pale kwa jukwaa. Thank you, our winners. Today is your day, so you shall still come back. Tupige makofi wanapoenda chini. Let us applaud them as they stand up. Our winners, just you take your seats just for a few minutes. As Her Excellency the First Lady of the Republic of Kenya will now view the lighting of KICC, Kenyatta International Conference Center, which was done in honor of the nurses and the midwives just the other night. Ladies and gentlemen, Your Excellency, ladies and gentlemen, to the screen.
Twakushukuru mama taifa kwa juhudi zako kuboresha Kenya. Wakenya wote twakuombea baraka tele mama taifa.
On the 3rd of December, Her Excellency Margaret Kenyatta, the First Lady of the Republic of Kenya, will host the 2021 Beyond Zero Summit. During this summit, whose theme is Increasing Investments for Primary Healthcare, Her Excellency will award nurses and midwives for their efforts in delivering primary health services. Today, Beyond Zero lights up KICC to honor all nurses and midwives across our country. We say thank you for your commitment. We say thank you for your compassion. We say thank you for your care.
And now the KICC is going to be lit. 9, 8, 7, 6, 5, 4, 3, 2, 1. KICC!
Twakushukuru mama taifa kwa juhudi zako kuboresha Kenya. Wakenya wote twakuombea baraka tele mama taifa. Twakushukuru mama taifa kwa juhudi zako kuboresha Kenya. Wakenya wote twakuombea baraka tele mama taifa.
Umekuwa baraka kwa Wakenya wote. Wewe mama wa taifa, tunakuenzi na tunakupenda because you are an icon. Thank you. Another round of applause to Her Excellency, the First Lady. If you visit Nairobi anytime when it's dark, pass by KICC. The winners of the Beyond Zero, nurses and midwives, every night until Christmas and New Year. Why don't you give another round of applause? And from today, when the winner will be mentioned here, the name of the winner will be rotating at KICC every night. Can you give another round of applause to the Beyond Zero? Thank you. I now want to call the clusters back on stage. I want to invite cluster 1 and 2 to the podium. Please make your way to the podium with your gifts now for a special photo with our champion, Her Excellency, the First Lady. Accompanied by the that is the first photo, Her Excellency, with the winners of Cluster 1 and Cluster 2. Tuwapigie makofi tena. Thank you. You may come walk down in style. Mlionyeshwa kutembea jana. Catwalk as Her Excellency remains there for a special photo. Yes. Cluster 3 and 4, kindly make your way to the podium. Let us give a round of applause. Five and 6, be ready. No, we must balance this line. Please come on this side, the ones who are joining. Let us balance, let us balance, let us balance. And our faces should show that we are winners. The whole nation is watching. Songa kidogo, umembana mheshimiwa mama wa taifa sana. Hapo. Thank you to the cameras. With smiling faces, show it to the world. You are the winners. Thank you. You may make your way around the stage as I invite the next cluster, cluster 5 and 6. Kindly make your way. Tutoke na pande ile. Okay, sawa nyinyi. It's okay. Wapi makofi? Can I hear some cheers? Yes, this is their day. This is their day, the winners. The work you are doing mashinani, tunaiheshimu sana. Thank you. Spread out. To the cameras, the winners. Somebody's not smiling. To the cameras. Cluster 7, the last cluster. Thank you. You live from the other side where Catherine Kasabuli is. Please exit on your right as cluster 7, the last cluster, takes on the stage. Wow. Another round of applause to the last cluster. Thank you. Thank you. You might now exit on your right. As I invite Madam Cass kindly to make her way on the stage for a special photo to represent the Ministry of Health, our mother ministry. And the PS kindly make your way there. That's a very special photo for our mother ministry. And their faces tells it all. Thank you. Our partners kindly make your way on the stage. The Nursing Service Director, MOH, the National AIDS Control Council, the Embassy of the People's Republic of China, and in the Republican area in Kenya, the Airtel, the Nursing Council of Kenya, the UN Resident Coordinator, the Council of Governors represented by Professor Anyang' Nyong'o, the Training College, our sponsors, the Roche, the US government, the AIDS Healthcare Foundation, our partners, kindly make your way for a very special photo because we recognize you. Public Service and Cast Gender, kindly make your way on stage. We have been honored with our cast and the PS. Kindly make your way on stage. Let us give them a round of applause. Thank you for coming to grace the occasion. Kindly. I hope your lens will capture the whole stage. Just wait as Professor Anyang' Nyong'o, His Excellency the Governor of Kisumu City, makes his way. That's a very special photo with smiling faces. Thank you for partnering with the Beyond Zero, and you have partnered with the champion, Her Excellency Margaret Kenyatta. Thank you. We may make our way down the stage.
Natal care only and not delivery care. Remotely.
on Monday and Tuesday. The 8th FOCAC ministerial meeting, Forum on China-Africa Cooperation, was successfully held in Dakar, Senegal. President Xi of China announced 9 programs to promote China-Africa cooperation in the next 3 years. You can imagine the poverty reduction and rural development, trade.
Your Excellency, these are our point men and women on the ground to make sure that we achieve our goal. Can I have 2 people on this other side so that that line can balance? And there, with smiling faces, to the cameras. Tuwapigie makofi tafadhali. Tuwapigie makofi. Thank you. You may make your way down the stage. Exit on your left as the last cluster makes their way on the stage. Cluster 7. Cluster 7, get ready. The cameras with smiling faces, and there it goes. Thank you. You may make your way down on this other stairs as we'll have the last cluster coming. Let us give them a round of applause as we bring the last one. The county chief nursing officers, for your tireless work you have done mashinani on the grassroots to make sure we have achieved our goal. The Beyond Zero Technical Working Group, kindly, can you get ready to go on stage? UNFPA, the Council of Governors representative, the AHF, the University of Columbia, the Philips, the National AIDS Control Council, and Men Engage. The ones I've mentioned, kindly, you are coming back on stage. We are coming on stage for the last photo. Thank you. Can we have the Beyond Zero Technical Working Group going on stage? The county first ladies present, kindly get ready to come for a photo up with Her Excellency the First Lady. To the cameras, just a minute, let's go, yeah. Can we all to the cameras with the smiling faces? This is the day the Lord has made for us, that we shall rejoice and be glad in him. If you agree with what I've said, a round of applause. Thank you. You may make your way down as I invite the county first ladies present to do a special photo. Thank you for gracing the occasion. The organizing committee, be ready, get ready. And title folder. the two logistics studio, the quality improvement consultants, the communication task force, and expert nurses to Beyond Zero, and the secretariat for the last photo. Can we all give them a round of applause? Thank you for gracing the occasion. Thank you. Thank you. Our last photo, which I've just mentioned, please make your way on stage. Thank you. This is a wonderful team, Your Excellency. Sleepless nights, making sure they work. They don't know time. They don't know dark, neither day. They're the ones who are bringing us the winners of today. Thank you. We appreciate you. You may make your way down the stage. Your Excellency, a special photo for my two MCs. These are icons, Catherine Kasavuli and Janet Mbugua. Kindly, as I request the cast and Madam PS to sit down, kindly. This is a very special photo, Your Excellency. They are always there for us wherever we invite them to come and moderate our programs. They're ever there. That's a special photo. It is your day. Can we give a round of applause to the icons? Yes. Thank you. Your Excellency, thank you for your time. It's a wrap, Your Excellency. Oh, yes, it's a wrap now. Tumpigie Mheshimiwa Mama wa Taifa makofi ya mama. Thank you, Mashujaa Africa Band. Let us also appreciate the Africa Mashujaa Band led by Kathy Kirago for that one. As the State House Choir, Your Excellency, takes their position to make a presentation, I will now introduce a video of all the 578 finalists on the screen as State House Choir takes their position. On the screen are all the 578 finalists, Your Excellency. The names are being supered there. And as the names are being supered there, the State House Choir with Mashujaa, because these are our heroes and heroines. We are celebrating them today, and for that cause, Your Excellency, Mashujaa wetu wa siku ya leo.
Mashujaa wetu Kenya, wazalendo wetu Kenya, tutawapongeza kwa kujitolea kwenu kutumikia taifa letu. Tutawakumbuka kwa kujitolea kwenu kutumikia taifa letu.
Administrator Squire, just relax there. We will give you another chance. You seem to be too energetic. Your Excellency, the First Lady. And now I would like to invite Dr. Ruth Marsha of National AIDS Control Council, and I saw the chair, Angeline Siparo. Please make your way on stage. And as they come on stage, I would like also to invite the board members. I saw them, yes. Just come, make your way on stage. And as they come on stage, I would like humbly to request Your Excellency, the First Lady, it's your day, and you're a champion, to make your way back on stage again. A round of applause to Her Excellency, the First Lady. I need another microphone here.
Your Excellency, Mama Margaret Kenyatta, distinguished guests, ladies and gentlemen, good morning. Good morning. I am so excited. And with me here is my CEO of the National AIDS Control Council and our board members. You know that we are represented fully across government and among private stakeholders. And I also acknowledge the presence of our minister here and our permanent secretary. Mama Margaret, they say success has many fathers and failure is an orphan. Today, we are proud to be the parents of the Beyond Zero within the Ministry of Health. The National AIDS Control Council is overwhelmingly glad to partner with you. You have brought us favor, success, and as our CEO said, you taught us to run. Even places that some of us would not have run for our lives, we have run for children, and we want to thank you. And you have helped us reduce the number of mothers or children who are living with HIV. And I think for you, sometimes you think maybe it's normal, but it is not. To have this leadership, I have worked across the world. To have political leadership and have the leadership that you provided for us is not normal, and we don't take it for granted. You truly are our Shuja. And so today, it is my honor on behalf of the National AIDS Control Council and the partners seated here, because we are a multi-sectoral response. Everyone seated here, all the 263 corporations in government, all the partners who are seated here, it is because of them that we give you this gift today. So this gift is a small token that you will know that each day, both for us, I come from Masai land, I come from those ASAL regions, I come from those little manyatas. You have made a difference where nobody had done that before. Ooh, many people know that it's very rare to make me speechless. So I want my board members to come and my CEO to hand over, and thank you, Connie, for always being a step away to be able to guide us. So thank you. So this is a gift. We know that you love elephants. I love elephants. But you notice that the elephant is cuddling the children around. So because I love elephants so much, the symbolism of this gift is the matriarch always leads the group. They only get the bulls in for protection. So we acknowledge His Excellency. But it is the matriarch that leads. And so the elephant has gathered all its babies. And for those who cannot see from far, up there we have the signpost, Beyond Zero, empower mothers, empower children, end new HIV infections, empower youth, end stigma. No mother should be die giving birth. And then our goal is to end AIDS. So thank you, Washuja. Thank you.
That's wonderful. Another round of applause. Your heart is so big like an elephant, Your Excellency. Thank you, thank you. Your Excellency, remain there. A special photo for that. Wonderful. Thank you, National AIDS Control Council, with the board members, led by the chair, Angeline Siparo. Thank you. You may walk down the stage. Your Excellency, remain there. It's your day. We cannot afford to take it down. And as the First Lady remains on stage, allow me to invite the Roche, please, our partners, for a very special moment. Just make your way on the stage. The gift will find you there. And there, that is the Roche family making their way on the stage to make a presentation to Her Excellency. Can you present the items to Her Excellency?
So, Your Excellency, I just brought this bottle here. Everyone can see it's pink because of your running. I've seen you run with the ladies, with gentlemen, for HIV and for awareness for cancer in this country. So when I found this bottle, I thought, I want you to remember us and to remember all the women who are impacted when you do your runs, and you can fill it with water, just simple water. Thank you so much. Thank you. And these are biscuits for your family.
Can we give her a round of applause because she has remembered even the first family with a biscuit. Thank you. We appreciate Your Excellency. You may now take a seat. I humbly request with a lot of humility that you take a seat down. Yes. So you'll be led to your seat by Kathleen Kasavuli. Thank you. And as Her Excellency takes her seat, we come back on the other side of the stage, and also we zoom our eyes on the screen, Status Choir, with another number. We are celebrating the nurses. It is your day today. It is your day.
Shukuru mama taifa kwa juhudi zako kuboresha Kenya. Wakenya wote tunakuombea baraka tele mama taifa. Tukushukuru
the First Lady. You are allowed to stand and to dance with the choir.
Zote nchini Kenya umetetea haki za watoto walio na mahitaji maalum na kuhimiza tume ya hifadhi mazingira na wanyama wa pori. Tukushukuru mama taifa kwa juhudi zako kuboresha Kenya. Wakenya wanapenda wote baraka tele mama taifa. Tukushukuru mama taifa kwa juhudi zako kuboresha Kenya. Wakenya wanapenda wote baraka tele mama taifa.
Children born with disabilities
as we come, we all dance for that song. It's a dancing song to all the members. Choir members, go and celebrate with the nurses. Go to them as we celebrate with the nurses. Go celebrate.
Tunamshukuru Maulana kwa kutupa kiongozi mwenye hekima, kwa kutupa kiongozi mchapakazi, kwa kutupa kiongozi mwenye upendo, naye ni mama taifa wa nchi yetu Kenya. Watoto vijana Kenya nzima, kina mama kina baba Kenya nzima, tunafurahia uongozi wako, tunazitambua juhudi zako, tunafurahia ukarimu wako, tunashughulisha maendeleo.
Celebrate the First Lady. Watoto
Kenya nzima, kina mama kina baba Kenya nzima, tunafurahia uongozi wako, tunazitambua juhudi zako, tunafurahia ukarimu wako, tunashughulisha maendeleo.
Let us celebrate. Let us celebrate the winners.
Umeyatimiza mambo mengi mazuri sana.
Wewe First Lady umetimiza. Hey.
Kweli umezingatia huduma bora. Umetuonyesha kuwa wanyenyekevu. Kazi zako za faidi watu wote. Wewe ni mfano bora kwa viongozi wote. Watoto vijana Kenya nzima, kina mama kina baba Kenya nzima, tunafurahia uongozi wako, tunazitambua juhudi zako, tunafurahia.
Wapi makofi na vigelegele?
Tunashughulisha maendeleo. Hongera tena sana watoto vijana Kenya nzima, kina mama kina baba Kenya nzima, tunafurahia uongozi wako.
Let us go back to our tables. We dance as we go back. We dance as we go back, nurses. Thank you, Chief Nursing Officers. Tunafurahia ukarimu wako mama. Now we dance. Before we sit down, we dance.
Kazi nzuri unayoifanya shujaa wa Kenya.
Makofi kwa shujaa wa Kenya, Your Excellency. Thank you. Ubarikiwe na baraka ambazo zitakoma. Your Excellency, before we come to the close, we are coming to the moment whereby I'll now invite Daniel Okuku to do the call to action. Without this, then there was no meaning of this conference. Can we give him a round of applause as Daniel Okuku comes on the podium.
Your Excellency, the First Lady of Kenya, Mama wa Taifa, the mother to nurses of Kenya. On behalf of nurses and their president, I want to tell you that nurses of Kenya appreciate you. And as I also stand here, I'm alive because my mother pushed me, still wrapped in membranes, and it called for the intervention of the Kenyan Army nurse who ruptured the membranes, and therefore I'm called Okuku because of that. Beyond Zero Health Award call for action. Nurses of Kenya collectively commit to re-energize the efforts to attain universal health coverage. This they are aiming to achieve by accelerating progress towards universal health coverage, which greatly relies on investments in primary health care to bring services closer to people. Amplifying preventive services as a game changer for primary health care because it serves communities and empowers them to choose healthier lifestyles, prevent diseases, or access early detection, treatment, and recovery. Acknowledging people-centered primary health care, which, with equity in service delivery, ultimately paves the way for a fairer, healthier world for families and communities. Appreciating frontline workers, particularly nurses who are the first point of care for individuals, families, and communities. Urging individuals and communities to embrace healthy choices and maintain positive health-seeking behaviors. And finally, optimizing the devolution opportunity to respond to the varying distribution of the health workforce, as well as match the skills and infrastructure at primary health levels across the country. Long live nursing. God bless nurses. Thank you.
Thank you, Bwana Daniel Okuku. Thank you for that wonderful remarks. That is a call to action, and from today henceforth, that is the way to go. Your Excellency, we have come to the end of this program. We wish you could stay longer, but we have to bring the curtains down now. My request that we all be upstanding as the Kenyan national anthem shall be played, and thereafter I will announce. All the CNOs and finalists to collect their gifts from the tent next to the Beyond Zero mobile clinic. At this moment, while standing, Her Excellency, our chief guest, will leave at her own pleasure anytime she feels like sitting, living, interacting. Thank you. As the Status Choir ushers out as we go. Beyond Zero, we celebrate you. Thank you very much.
Campaign distributed.
It is okay.
At the start of 2014, I launched the Beyond Zero campaign, distributing mobile clinics throughout Kenya. These clinics are an important step in the process of bringing health to the people and adapting solutions to suit communities' particular environments.
Sote tunakushukuru mama wa taifa Margaret Kenyatta kwa kazi nzuri unayoifanya kutupa maisha yaliyoboreshwa. Wana Kenya sote tunakushukuru mama wa taifa Margaret Kenyatta kwa kazi nzuri unayoifanya kutupa maisha
bila shaka mtazamaji, hizo ni picha za moja kwa moja kutoka katika ikulu ya Nairobi, ambapo hafla ya mkutano wa Beyond Zero awamu ya pili imekamilika muda mfupi uliopita. Ni hafla ambayo ilikuwa ikiongozwa na mama wa taifa Bi Margaret Kenyatta, ambapo leo hii wauguzi na wakunga 578 walikuwa wanatuzwa kutokana na kazi ambayo wamekuwa wakitekeleza katika hospitali mbalimbali za serikali humu nchini chini ya mpango huu wa Beyond Zero. Kumbuke ya kwamba wauguzi ndio wako katika nafasi ama ile mstari wa mbele katika kutoa huduma za afya ile ambayo inajulikana kama afya ya msingi, na hivyo basi leo hii walikuwa wanatuzwa kutokana na yale majukumu yao pamoja na wale wakunga kutoka katika kaunti 47. Na hivyo basi mtazamaji, sasa hivi tunavyozungumza ni kwamba majina ya wale wauguzi na wakunga 578 ambao wametuzwa leo hii yatakuwa yameandikwa pale katika jumba la KICC, na majina hayo yatakuwa pale hadi siku ya Krismasi ambayo itakuwa ni tarehe 25 mwezi huu. Leo hii mada ama kauli mbiu ya kongamano la leo ilikuwa ni kuhusu kuongeza uwekezaji katika huduma za afya, hasa afya ya kimsingi. Kumbuke ya kwamba hiyo ni mojawapo ya zile hatua za serikali ya Kenya kuhakikisha ya kwamba tunapata kuweza kutoa huduma ya afya kwa kila mmoja chini ya ule mpango wa UHC. Na hivyo basi mama wa taifa tu ameangazia masuala mbalimbali na kusema ya kwamba kunazo hatua ambazo zimepigwa tangu mwaka 2013 wakati ambapo mpango huu wa Beyond Zero ulikuwa umezinduliwa humu nchini. Na hivyo basi mtazamaji, kutoka upande huu hatuna la ziada, lakini tutakuwa tunakupa mengi zaidi kwenye taarifa zetu mwendo wa saa 7 kamili kwa sasa hivi, na kupeleka kwenye studio zetu tuendelee nacho kipindi cha Michirizi ambacho kinaongozwa naye Bernard Okumu. Mimi naitwa Nancy Okware.
Okware kwa kuweza kutupa habari hizo kutoka katika ikulu ya Nairobi, ambapo kulikuwa na hafla na mkutano wa Beyond Zero ambao umeandaliwa na kufanyika kuongozwa na mlezi wa mpango huo Bi Margaret Kenyatta, ambapo wahudumu na vilevile wauguzi wa huduma ya afya wameweza kutuzwa na kwa kuweza kuwa katika mstari wa mbele katika utoaji wa afya ya kimsingi na vilevile mpango wa UHC. Ni wakati wa kuchirizika. Karibu kwa makala ya leo ya kipindi cha Michirizi, ambapo tunaangazia taarifa za soka humu nchini barani Afrika na vilevile katika bara Ulaya au duniani. Na humu nchini yapo mengi tu ambayo yanaendelea kufanyika katika ulimwengu katika soka, ambapo timu za humu nchini Tusker na Gor Mahia zinajiandaa katika michuano yao mbalimbali ya kufuzu kwa kombe la mashirikisho barani, sawa na ligi kuu na vile vile michuano ya ligi kuu na ligi ya kitaifa ya NSL kurejelewa weekend hii. Na taarifa za soka kutoka barani Afrika, ambapo CAF imetoa makata kwa timu ambazo zitashiriki katika michuano ya kimataifa au katika barani Afrika mwaka ujao zio na timu za kinadada hizo, na taarifa nyingine nyingi tu. Nitasaidia nao Jaco Sylvester na Jared Odendo ambao wapo katika safu ya uchambuzi. Karibuni sana katika makala leo ya Michirizi.